Being 2 p.m, Senator, move to questions without notice. Senator Wong.
I seek leave to make a statement relating to shadow ministerial arrangements.
Leave is granted.
I thank the Senate. I advise that the opposition has made 2 changes affecting shadow assistant ministers. Ms Meryl Swanson MP has been appointed as Shadow Assistant Minister for Defence, replacing the Honourable Dr Mike Kelly, AM MP. Senator Jenna McAllister has been appointed as Shadow Assistant Minister for Communities and the Prevention of Family Violence, a new position in addition to her existing responsibilities in the portfolio of Families and Social Services, the Honourable Linda Burney MP. I congratulate both Ms Swanson and Senator McAllister and seek leave to table the revised Shadow Ministry list and to have it incorporated into Hansard.
Leave is granted. Senator will move to questions. Senator Gallagher.
Thank you, Mr President. My question is to the Minister for Aged Care and Senior Australians, Senator Colbeck. Minister, on Friday you could not tell the Senate Select Committee how many aged care residents had passed away from COVID-19. Can the Minister tell us today how many residents of aged care facilities funded and regulated by the Morrison government has passed away, since he failed to provide that answer?
Minister for Aged Care and Senior Australians, Senator Colbeck.
Thank you, Mr President. Thanks, Senator Gallagher, for the question. And can I, at the outset, express my sincere condolences to every resident's family who've lost a loved one during the pandemic into aged care. Can I also say that I should have had the data on Friday, and I apologise for not having done that. To my colleagues who I have successfully taken the attention off what it should be, which is our efforts to combat the virus, but also to the Senate. I should have had the information, and my fault, my responsibility, and I take full responsibility for not having that information available to me at the time. Mr President, sadly, nationally, since the commencement of the pandemic, there's 335 Australians who have passed away in residential and in home care. Mr President, there have been 7 home care recipients and 328 residential care recipients who have passed away. It's an absolute tragedy. Every single one of those deaths is an absolute tragedy. And that's why this government's worked so hard since the beginning of the pandemic to put in place measures to firstly protect Australia through the National Health Pandemic Plan, and then the other measures that we've put in place, which now total in excess of $1 billion to support the residential aged care sector to manage the virus and to protect Australians, particularly those in residential aged care, because we know that they, in the sense of if they contract the virus, are the most vulnerable. So right from the outset, right from January, when we first started talking to the sector with respect to what they ought to be doing in preparation, then with the National Health Pandemic Plan that we put together in...
Time for the answer has expired. Senator Gallagher, a supplementary question.
Thank you, Mr President. Can the Minister tell us today how many residents of aged care facilities funded and regulated by the Morrison government have now contracted COVID-19?
Senator Colbeck.
Thank you, Mr President. So far, across Australia, there have been 1,761 residents of residential aged care facilities, who have contracted the virus.
Senator Gallagher, a final supplementary question.
Thank you. Maria Vasilakis, who just celebrated her 81st birthday, died alone after contracting COVID-19 at St Basil's. Maria Rukavina, who tested positive after being hospitalised with long-standing skin infections, died alone in the Epworth Hospital. Her son Ivan had gone 5 days without getting an update on her condition. What does the Minister have to say to the 335 families grieving the loss of a loved one about his failure to remember the number of older Australians in aged care who have died from COVID-19?
Senator Colbeck.
Thank you, Mr President. As I said in my first answer, I offer my condolences, my sincerest condolences, and that of the government to every single one of those families who lost a loved one. It's a tragedy. Every single life that has been lost is an absolute tragedy. It's the tragedy of this wicked, wicked virus. And I offer my apology to them for not knowing the number, as I did in my primary answer. I should have had the information. I didn't, and I take full responsibility for that. I should have had that data. I apologise to those people who I wasn't able to give that answer to.
Senator Mackenzie.
Thank you very much, Mr President. My question is to the Minister representing the Minister for Health, Senator Cash. Can the Minister please update the Senate on how the Liberal and the Nationals government is supporting Victoria through its coronavirus second wave outbreak and driving health recovery in Victoria?
The Minister representing the Minister for Health, Senator Cash.
Thank you, Mr President, and I thank Senator Mackenzie for the question. Mr President, as we've seen over recent months, supporting Victoria to suppress community transmission of COVID-19 is critical, not just to economic recovery, of course, but also to save lives. Sadly, as a result of the second wave of COVID-19, we have now seen over 517 Australians lose their lives. The Morrison government has stepped up our support to the Victorian government to assist them in combating the effects of COVID-19. The Australian government's Department of Health is assisting the Victorian Department of Health and Human Services to undertake contact tracing. Over 1,700 Australian Defence personnel are currently deployed to Victoria to assist with contact tracing, testing, Victoria Police checkpoints and logistics. The government has substantially increased dispatches of personal protective equipment, PPE, from the National Medical Stockpile in July and August. Of the more than 66 million masks dispatched from the National Medical Stockpile to date, over 23 million masks have been dispatched to Victoria, including 9 million masks dispatched for Victorian aged care providers. The Australian government is dispatching 186,000 goggles from the National Medical Stockpile to assist Victorian general practitioners and allied health providers. Additionally, the Australian government has established 28 GP-led respiratory clinics in Victoria, providing free holistic care and testing for patients with respiratory illness. Respiratory clinics in Victoria have assessed more than 153,200 people and conducted now over 138,000 tests.
Senator Mackenzie, a supplementary question.
Thank you, Minister. As the second stage of lockdowns has placed additional strain on the mental health of Victorians, what support is the government providing to bolster mental health services?
Senator Cash.
Thank you, Mr President. The Australian government is making a significant investment to support the mental health of all Australians, but indeed the mental health of Victorians. We're investing $26.9 million to create 15 mental health clinics across Victoria, 9 in Melbourne and 6, Senator Mackenzie, in regional Victoria. We're investing $5 million to enhance digital and phone services for groups that are experiencing significant challenges during the restrictions that are now in place, $14.6 million to support mental health providers respond to increased demand in Victoria, including $5 million to support Headspace, $2 million to support the Kids Helpline, $2.5 million to support Lifeline and $2.5 million to support Beyond Blue. The impacts of the COVID-19 outbreak, physical distancing and isolation can make us feel anxious, stressed and worried. And our message to Australians is, if you are suffering, we can help you with the help you need.
Time for the answer has expired. Senator Mackenzie, a final supplementary question.
Thank you. Can the Minister please update the Senate on the state of the Australian response to COVID-19 and why it's still important for all Australians to remain vigilant and take precautions to stop the spread of COVID-19?
Senator Cash.
Thank you, Mr President. And our testing in Australia has now seen 5.7 million tests conducted across Australia. Of those, over 24,821 Australians have been diagnosed with COVID-19, and as I stated in my first answer, sadly 517 Australians have lost their lives. Our tracing effort, though, has been critical in our response, and the COVID Safe app has now seen over 7 million downloads and is enabling us to trace, obviously, those cases. We are now at a very important moment nationally. In June and July, we saw positive signs of economic recovery in the states that have suppressed the virus. It is critical that we support Victoria to contain community transmission so that we can protect the lives of Australians and their livelihoods. The Victorian second wave has made it clear how we must all follow
Senator
and observe
Cash, time for
social
your answer
distancing
has expired.
practices.
Senator Keneally.
Thank you, Mr President. My question is to the Minister for Aged Care and Senior Australians, Senator Colbeck. How many aged care residential facilities are currently experiencing COVID-19 outbreaks?
The Minister for Aged Care and Senior Australians, Senator Colbeck.
Thank you, Mr President. Thanks, Senator Keneally, for the question. Currently, there are 126 facilities in Victoria that have a COVID-19 outbreak.
Senator Keneally, a supplementary question.
Is that the national figure?
Thank you, Mr President. I note that wasn't the full answer to my question. I did ask for the national figure. Perhaps the Minister could update that, as he also answers how many aged care residential facilities have now recorded more than 100 cases.
Senator Colbeck.
Senator, thanks, Mr President. On the figures that I have, the only facilities with a current outbreak are in Victoria. So that is the national figure of facilities with a national outbreak. And I don't have an individual breakdown of all facilities with me at question time here now. I'm very happy to bring back to you an answer to that question, but I don't believe there is any facility that has more than 100 residents that are positive, but I'll confirm that at the end of the question time for you.
Senator Keneally, a final supplementary question.
Can the Minister advise the Senate when the first outbreak at Epping Gardens Aged Care was first reported, and how many COVID-19 cases have been reported at that facility since?
Senator Colbeck.
Thanks, Mr President. As I said, I don't have a detailed breakdown of every facility, the first date of the outbreak or the number of residents and staff who have tested positive. I'm happy to provide that information to the Senate at the end of question time.
Point of order. On a point of order, Senator Keneally.
Thank you. I appreciate the Minister is attempting to answer the question. Could he, if he's going to take it on notice, could he confirm that the answer is 210
Senator
cases?
Senator Keneally, please. That's not a point of order at all. Sorry, Senator Cormann.
That was just my point. This was absolutely not a point of order. This was a political point. If Senator Keneally has the answer at her fingertips, because she, of course, knows the question that she was going to ask, why did she ask it if not for anything other than just playing politics with what is a very serious issue?
Order.
You should be ashamed of yourself.
Order. I will call Senator Wong when there's silence. Order. Senator McGrath. Senator Wong.
This is a very serious issue. This involves the deaths of too many Australians, and it is entirely appropriate that the opposition ask this minister questions which go to his handling of this crisis. That is what the opposition is doing, and that is what the opposition will continue to do.
Okay. Firstly, on the point of order, Senator Keneally, you know better that wasn't a point of order. I remind senators that when they rise on a point of order, they have to point to the standing order they believe is being breached. It's not up to me or the chair to go to the motives of anyone seeking an answer to a question in question time. I've allowed the two leaders to make observations on that point, and I urge senators to remember the standing orders when they're asking, answering questions and raising points of order. Senator Colbeck.
Mr President, and as I said, there are 126 facilities in Victoria with an active case right now. I don't have a full list of all those 126 cases with me, but I have committed to getting back to Senator Keneally and the chamber at the end of question time with the details that she's asked for.
Order. Senator Patterson.
Thank you, Mr President. My question is to the Minister for Defence, Senator Reynolds. Can the Minister update the Senate on what practical support Defence has been providing to states and territories to minimise the spread of COVID-19 and drive our health recovery?
The Minister for Defence, Senator Reynolds.
Well, thank you very much, Mr President, and I thank Senator Patterson for the question and for his tremendous support for our troops in Victoria at this time. I am so proud of the efforts of the Defence Department and also our ADF and also their families' support during the COVID-19 pandemic. The ADF very quickly adapted and developed new business-as-usual processes and practices during COVID-19. We did that to ensure Defence keeps our people in Australia and also over 2,000 personnel deployed overseas to keep them safe when on training exercises, when actually on exercises on operational deployments and also on routine postings. We did that to make sure that we adapted very early, and then we now maintain the best possible health protocols. Since February, under Operation COVID-19 Assist, Defence has been providing a wide range of support to all states and territories with their COVID-19 response. And Defence has demonstrated great capability and great agility in that support. Providing support has been in many forms, in traditional tasks such as planning, logistics and also in health support, but a number of new tasks such as contact tracing and also training to drive ambulances. Today, over 3,400 ADF members are supporting all states and territories with their COVID responses. And throughout the pandemic, Defence has been postured to respond to requests for support, again, from all states and territories. Following the Prime Minister's offer to all First Ministers on the 27th of March with assistance with the ADF for mandatory hotel quarantine, the ADF prepared 100 personnel in each large state and 50 in smaller states. The following day in New South Wales, ADF personnel began supporting the reception of international arrivals. And can I say to all colleagues here, we have much to be proud of in how our ADF has responded to Operation Bushfire Assist and COVID Assist.
Expired. Senator Patterson, a supplementary question.
Thank you, Mr President. I do. Can the minister provide further detail on the support provided to authorities in my home state of Victoria?
Senator Reynolds.
Thank you, Senator Patterson, and yes, I can. Our ADF personnel have been assisting Victorian authorities since the 23rd of March this year with its COVID-19 response. Since then, we have supported 11 separate Victorian requests for assistance. Today, 1,700 Defence personnel are deployed to Victoria to support its latest efforts to get this next wave under control. For example, 330 ADF personnel are supporting contact tracing through data management, admin and logistics support, and also door-knocking close contacts unable to be contacted by phone. 250 ADF personnel are supporting COVID-19 testing right across the state of Victoria. 150 ADF personnel are supporting 7 Victoria Police vehicle control points. And as I said, ADF are providing support in new ways, including doing training with Ambulance Victoria and also now doing training and assistance to the Victorian Aged Care Response Centre. Again, I thank them all for their service.
The answer has expired. Senator Patterson, a final supplementary question.
Thank you, Mr President. Can the minister also provide further detail on the support provided to Western Australian authorities?
Senator Reynolds.
Well, thank you very much, Mr President, and yes, I can. The ADF has been providing critically important support to the West Australian government authorities since the 22nd of March this year. Since then, we have supported 10 separate WA requests for assistance, and today 112 ADF personnel are on the ground in Western Australia. But at its peak, on the 22nd of April, the ADF had 326 personnel assisting West Australian authorities with their COVID-19 response. This builds on the support the ADF had provided earlier in March to assist with the cruise ship disembarkation, and that assistance provided included assistance with quarantine compliance checks and also a range of logistics support, including cargo transportation. And on the 3rd of August this year, we did agree to provide 50 ADF personnel to support WA authorities with hotel quarantine at 5 hotels, and we're now working with them on a new request.
Order. Senator Reynolds. Senator Siewert.
Mr President, my question is to Senator Colbeck, the Minister for Aged Care and Senior Australians. Minister, through you, Mr President, on Friday the government announced $171 million additional funding for aged care, while experts acknowledge that an additional investment of $3.5 billion is what's actually needed to improve hours of care and workforce conditions and address other aged care issues. Minister, are you going to invest the $3.5 billion that's recommended to be needed to fix the aged care sector?
The Minister for Senior Australians and Aged Care, Senator Colbeck.
Thank you, Mr President. And thanks, Senator Siewert, for the question. The $171 million that we announced on Friday was a further contribution towards our response to the COVID-19 pandemic. That's what it was specifically targeted to do. It wasn't designed to fix the aged care sector. Different situation. Mr President, we are currently in the middle of a Royal Commission into the aged care sector, which was given the task of forensically looking at the entire aged care sector and then coming back to government with recommendations on what we should do to improve the residential aged care sector in this country, in fact including the home care sector. We are watching that process very closely. Our officials engage with the Commission on a regular basis. They continue to issue papers, including one that they issued this morning with respect to quality indicators. And we will respond, as I have said and as the Prime Minister has said, to the Royal Commission when it makes its recommendations. I acknowledge, the Prime Minister has acknowledged, that's why we called the Royal Commission, that there are issues with residential and the aged care sector more broadly in this country. Clearly there are. That's why we called the Royal Commission. We look forward to its report when it reports on the 26th of February next year. And the objective that I have, and I know that the Prime Minister has, is for us to make a significant response to that Royal Commission report in our budget next year. So that's the timeline that we have. We acknowledge that there's additional funding that's required for this sector, and we have invested significantly in this sector since in the last two budgets, in excess of, say, $3 billion for 50,000
Senator Colbeck,
home care
time
places.
for the answer has expired. Senator Siewert, a supplementary question.
Thank you. On Friday at the COVID committee hearing into aged care, you said that no country in the world has avoided COVID-19 outbreaks in aged care facilities. Does that mean that Australia doesn't have to try harder to prevent further outbreaks? Minister, don't you agree that Australia should be aiming to do better than the UK, Canada and the US, where so many people have died in aged care?
Senator Colbeck.
Thank you, Mr President, and thanks, Senator Siewert, for the supplementary question. What I said was that where there has been significant community transmission, there has been COVID-19 outbreaks in residential aged care everywhere in the world. And with respect to your comments about a number of other countries, we actually are doing better than all of those, significantly better than all of those. In fact, our circumstance with respect to infections in residential aged care as a number of residents and or more deaths as a proportion of aged care places is 35 times better than the UK. It is 35 times better than the UK. In fact, we're doing better than all of those countries.
Senator,
we are one of the best in the world in respect of
Senator
residential
Colbeck, please resume your seat. I've got Senator Cormann on a point of order.
Thank you very much, Mr President. On a point of order, interjections are always disorderly, but they're particularly disorderly when they're complaining about a minister answering the question that was asked in a way that is directly relevant to the question that was asked.
Interjections are always disorderly. I was calling the chamber to order, and I thank you for helping me remind the chamber, Senator Cormann. Senator Colbeck. Order.
Mr President, and as I've said a number of times today, every single death in residential aged care is a tragedy. I again offer my condolences to every family who's lost a family member. That's why we have worked since the outset of this pandemic to mitigate the opportunities for—
Senator Siewert, a final supplementary question.
Thank you, Mr President. In August, the Aged Care Quality and Safety Commission undertook 74 spot checks in Victoria and 41 spot checks in New South Wales. Minister, through you, President, will you guarantee that the government will undertake an audit of every aged care facility in this country to ensure that they are fully prepared and we don't see the same sort of outbreaks that we have just seen in Victoria?
Senator Colbeck.
Thank you, Mr President. Throughout this pandemic, the government has continued to work with closely with the residential aged care sector to provide them with information, with advice, with funding to assist them to mitigate the entry of COVID-19 into residential aged care and to assist them to deal with it if it does. We've done that on a consistent basis and we will continue to do that. This morning we released the Newmarch report, which I provided directly to every single aged care provider in the country. We've already implemented a lot of the learnings from Newmarch in our response in Victoria. We continue to do that. And we continue to work with residential aged care providers across the country, including a decision out of National Cabinet last Friday, where we will be working through the Quality and Safety Commissioner with states to visit every provider, commencing in Victoria, in Tasmania and Queensland, to ensure that their systems are up to speed. And if we find an opportunity for improvement, we'll push for
the answer has expired. Senator Wong.
Thank you, Mr President. My question is to the Minister for Aged Care and Senior Australians, Senator Colbeck. On the 12th of April, Minister Colbeck declared he had planned for, and I quote, worst-case scenarios. Given 335 older Australians in aged care have now tragically died from COVID-19, does the Minister believe Australia is now beyond the worst-case scenario?
The Minister for Aged Care and Senior Australians, Senator Colbeck.
Thank you, Mr President. Thanks, Senator Wong, for the question. In the context of residential aged care nationally, we are in a relatively good position, given that nearly over 80% of the facilities in this country haven't contracted a case of COVID-19. We've been very fortunate. We have been very fortunate. Well, Senator, thank you for the interjection, but as I've said a number of times, every death from COVID-19 in an aged care facility, every death from COVID-19 is an absolute tragedy. Every death. And I again offer my condolences to all of them. But this government has, since January, worked extremely closely with the sector to provide it with the advice and the resources to assist it to manage the COVID-19 outbreak. Have we got it right all the time? No, we haven't. And I've acknowledged that. But we continue, as we learn about this virus, which didn't exist before November last year, as we learn more about the virus, we learn more about the way it spreads, and we learn more about the measures that we need to take, we continue to implement those. And we are still learning, Mr President. We are still learning. We are still talking to the AHPPC about what we might do. We are still discussing at National Cabinet level what more we might do so that we can continue to provide quality care and protect senior Australians who are in residential aged care and home care from the scourge of this terrible virus, which, when it gets into that age cohort, has absolutely devastating results. And that's what we will continue to do. We will continue to invest, we will continue to learn, and we'll continue to work closely with the sector as we've done right through the pandemic.
Senator Wong, supplementary question.
On the 7th of July, this minister declared that his aged care system had, and I quote, responded incredibly well. Incredibly well. Given that 335 Australians have now tragically died from COVID-19 in aged care, does he still believe the Morrison government has responded incredibly well?
Senator Colbeck.
Thank you, Mr President. I said that the aged care sector had responded incredibly well, which is what was in the initial part of Senator Wong's question. And we've worked very closely and we've worked very hard, taking the advice of the medical professionals in the AHPPC to provide advice to the sector. And the subcommittees of the AHPPC, the CDNA, who have provided guidance updated now on 3 occasions to the sector. I think the sector have done well. We've been fortunate in this country. We've been extremely fortunate that the front line of our defences, which were closing our borders early, including to China, setting up our national COVID-19 health response, has been largely effective. We didn't expect that the systems in Victoria would fall down in the way that they did. But As that's occurred, Mr. President, as that's occurred, we've continued to respond
Senator Colbeck,
and to build
time
our
for the
response.
answer has expired. Senator Wong, a final supplementary question.
Thank you, Mr. President. Today the minister has dismissed concerns about his performance, saying that we're doing better than almost any other country. Dismissed concerns saying that Australia is in a relatively good position. Isn't this just yet another example of the very arrogance and hubris in the Morrison government when it comes to aged care that the Royal Commission referred to? Arrogance and hubris.
Senator Colbeck.
Thank you, Mr. President, and I completely reject the premise of the question from Senator Wong. She can try and verbal me, she can try and put words in my mouth, but I don't have to accept it. We have continued to work closely.
Order. Senator Cormann on a point of order.
Interjections are always
You're
disorderly.
reading my
The
mind,
Leader of the
Senator
Opposition should be aware of this, and this is an issue that deserves to be treated appropriately, and I would ask you to call Senator Wong to order.
Interjections are always disorderly. I would add that regardless of the matters being discussed. Senator Cormann.
Senator Wong is interjecting even on the President. That is even more disorderly.
It's not.
As you are speaking.
We haven't been here for a while. It's not the best way to start a couple of weeks. I ask people to restrain their urge to interject, as it's always disorderly. Senator Colbeck to continue.
Thank you, Mr. President. So in rejecting the premise of Senator Wong's question, I note and I commit this government to continue to working with the sector, continuing to learn about the virus, continuing to take the health advice from the health professionals within the AHPPC and its subcommittees in the CDNA to ensure and continuing to invest where it is needed to ensure that senior Australians in residential aged care continue to be protected from the virus, and we work with state governments on the public health response to ensure that we reduce as much as possible the community transmission that is the source of infections.
Thank you. And today being a day for firsts, I will be calling our first question virtually, and I call Senator Roberts.
Thank you, Mr. President. Can you hear me?
It's all good, Senator Roberts.
Thank you, Mr. President. My question is to Senator Birmingham, representing the Minister for Energy. I commissioned the highly respected economist, Dr. Alan Moran, to review government economic and energy data and to calculate the true cost of climate policies and so-called renewable energy. He delivered his report to me last week, and a copy has been sent to every member of federal parliament, including Senator Birmingham and the Minister for Energy. Dr. Moran's work cannot be sensibly refuted, since he uses the government's own data that used to be published in a consolidated form until the cost of intermittent solar and wind energy sources became so embarrassingly and devastatingly high. Is the Minister aware that the true cost of climate policies on households through electricity prices is a staggering $1,300 per household per year?
The Minister representing the Minister for Energy and Emissions Reduction, Senator Birmingham.
Thanks, Senator Ryan, and
Order.
And I thank Senator Roberts for his historic question, at least in that sense. Mr. President, in relation to the report that Senator Roberts references by Dr. Moran, I have not seen a copy of that report. It may well have been sent to my office, and I'm sure the Minister for Energy will find an opportunity to review that work at an appropriate time. In terms of the questions of energy prices, Mr. President, our government is certainly determined to continue our work to reduce energy prices wherever we possibly can. Since July last year, we put in place our price safety net to cap standing offer prices in the energy market, and for residential customers who were on the highest standing offers before 1 July last year, they could well be better off by up to $666 per annum in New South Wales, $590 in South Australia, or $725 in South East Queensland, in Senator Roberts' home state. These reforms are making tangible differences to household energy prices and are bringing them down. Our introduction of a reference price requiring retailers to advertise offers in a way that's transparent and easy to compare, has, according to the ACCC, seen the cheapest market offer, as at September last year, some $290 to $355 lower in New South Wales, $262 lower in South East Queensland, $330 lower in South Australia. Indeed, average wholesale electricity prices as well in the national electricity market in the first quarter of this year were the lowest since the fourth quarter of 2016. Our reforms are making a difference in terms of energy price at the wholesale level and the retail level.
Order,
we will continue to work to reduce them.
Before I call Senator Roberts, can I ask senators to maintain silence just until we get the volume levels right so we can all hear Senator Roberts ask this supplementary question? Senator Roberts.
Thank you, Mr. President. Is the minister aware that the true cost of so-called climate policies and renewable energy on household electricity bills is not the 6.5% that government reports? It is a whopping and devastating 39%.
Senator Birmingham.
Thanks, Mr. President. As I said in my answer to the primary question, I've not reviewed Dr Moran's report, and I'm not aware that Minister Taylor or his department have done so either. Our focus continues to be as a government to get energy prices down whilst meeting our emissions reduction obligations, whilst also ensuring reliability in the energy markets. And we are recording achievements across all of those three spheres in terms of meeting our emissions reduction obligations and commitments that we make as a country, improving and delivering more reliability in the energy grid despite some of the challenges there have been previously, and as I was outlining before, getting prices down at a wholesale level, at a retail level, for households, for businesses. The ABS tells us we've seen reductions in the national average retail price over the last year. That benefits both households and businesses. And the AER has shown in a recent report that high-standing offers have been eliminated. These are tangible differences flowing through
Senator
in
Birmingham.
electricity bills for Australia.
Time for the answer has expired. Senator Roberts, a final supplementary question.
On average, your government incentivises $8 billion of incentives each year for malinvestment in parasitic green energy projects. That results in a net loss of jobs in the economy. Analysis of Spain's experience indicates that with every green subsidised job, 2.2 real jobs are lost. With over 1 million Australians losing their job and unemployment rising due to COVID-19, shouldn't the government be stimulating job creation, not job losses?
Senator Birmingham.
Thanks, Mr. President. And look, I assure Senator Roberts, as I do every member of this chamber, and indeed every Australian, that our government is working as hard as we can to create jobs to help Australia out of the economic disaster created by this pandemic. Our work in terms of supporting and sustaining jobs throughout the pandemic through programs like JobKeeper has been recognised as world-leading. Our effort in terms of deploying other policies, such as the Home Builder program, to head off potential declines in the construction industry, our effort to support the creative arts sector by attracting more production into Australia and supporting job generation and creation there, our efforts in terms of skills investment that Senator Cash is leading to make sure that Australians who may not have work at present are able to retrain for the future is all about creating jobs and helping Australians to get back into the employment market as we recover.
Senator Molan.
Thank you, Mr. President. My question is to the Minister for Foreign Affairs, Senator Payne. Senator Payne, through you, Mr. President, the explosion in Beirut was a shocking and distressing event that has rightly mobilised the international community. Can the minister detail Australia's support to the people of Lebanon in the wake of the shocking explosion on the 4th of August?
The Minister for Foreign Affairs, Senator Payne.
Thank you very much, Mr. President, and I thank Senator Molan very much for his question. Many Australians have been deeply saddened by the catastrophic explosion in Beirut, and our thoughts and sympathies go to all those affected by the tragedy, both here and in Lebanon, and most particularly to the family and the loved ones of Australian toddler Isaac Ola, who tragically died in the blast. Soon after the explosion, Mr President, Australia was able to announce $5 million in humanitarian assistance, which is being provided through international organisations, particularly the World Food Programme, the Red Cross, Red Crescent Movement and the United Nations Children's Fund. We have also delivered urgently needed humanitarian supplies, pre-positioned at the UN Humanitarian Response Depot in Dubai, and provided those to NGO partners leading the response in Beirut. On Friday, the 14th of August, a Dubai-based ADF C-130 delivered mobile warehouses to help replace critical storage facilities destroyed in the blast, and also shelter kits and tools for the up to 300,000 people left homeless. And then last Friday, the ADF completed a second delivery of additional shelter materials, and I acknowledge the support of those personnel to effect those deliveries. Those supplies were chosen after consultation with the humanitarian organisations that are leading the response in Beirut, and certainly targeted to fill the gaps and meet the most urgent needs. We'll continue to work with other international donors on possible further support, and our support will be based, Mr President, on need, on our ability to provide assistance in a timely manner, and also on what other countries are already doing in the context of the international response in particular.
Senator Molan, a supplementary question.
Thank you, Mr President. Can the minister outline what support the government has provided to Australians affected by this tragedy?
Senator Payne.
Thank you, Mr President. The Australian Embassy itself in Beirut was significantly damaged in the blast. Fortunately, only minor injuries were experienced by staff, and we appreciate the support provided to them to address those injuries. I don't, however, underestimate, Mr President, the psychological challenge that is accompanied by the experience that those staff have had, and I acknowledge the Ambassador and her team for the very professional work that they are doing. They've been working constantly to help Australians, and we deployed additional staff as well to Beirut to assist in the response. Our staff are providing consular assistance, working actively to identify opportunities for Australians in Beirut to depart, particularly in terms of the current incoming passenger restrictions, which does make that harder. They're providing many essential services, including the provision of emergency passports, and also continuing to make inquiries of local authorities. There are many dual nationals always in Beirut, in Lebanon more broadly, and for any further support that may be required to people in those circumstances.
Senator Payne. Senator Molan, a final supplementary question.
Thank you, Mr President. Australia's Lebanese community has responded with great humanity to the incident. How has the government been engaging with the Lebanese community?
Senator Payne.
Mr President, there has certainly been an outpouring of support from Australia's Lebanese community. It's admirable. It reminded us of the close relationship between our two countries, particularly through the almost 250,000 Australians of Lebanese heritage. Since the explosion, the government has convened a series of special teleconference meetings with leaders of the Australian Lebanese community. Minister Tudge and I attended one of those meetings, Minister Hawke another. They've been very important chances to both convey our condolences, Mr President, and to listen to the community's priorities as they are applied here in Australia, and also for family and extended contacts in Lebanon. For any Australians who wish to help, we do encourage them to provide a cash donation to trusted organisations that are delivering this urgently needed humanitarian assistance. We're working with the Lebanese community on the best mechanisms to achieve this, and certainly thank them for the commitment that they are bringing to the task.
Senator Payne. Senator Urquhart.
Thank you, Mr President. My question is to the Minister for Aged Care and Senior Australians, Senator Colbeck. Minister, who is responsible for aged care?
The Minister for Aged Care and Senior Australians, Senator Colbeck.
Thank you, Mr President. The responsibility for funding aged care, predominantly funding aged care, and also the administrative oversight of the aged care sector, the regulatory framework for the aged care sector rests with the Commonwealth Government.
Senator Urquhart, a supplementary question.
Thank you, Mr President. Last week, the Premier of Tasmania said aged care is, and I quote, very clearly a federal responsibility in terms of funding and regulation. Is Premier Gutwein right or wrong?
Senator Colbeck.
Thanks, Mr President. I think that Premier Gutwein's statement just agreed with the answer that I gave to the primary answer.
Senator Urquhart, a final supplementary question.
Can the minister confirm the government's own document released in February made clear the Australian government is responsible for protecting aged care residents by establishing and maintaining infection control guidelines and enforcing healthcare safety and quality standards?
Senator Colbeck.
As I said, Mr President, thanks Senator Urquhart for the question. The Australian government's responsible for the primary funding of residential aged care and its regulation. That's a clear statement, and I agree with that in the context of the question. We are at the moment—
Order. Senator Wong on a point of order.
I'm happy to sit down if the minister is going to get to the point. I had a point on direct relevance because Senator Urquhart put directly to the minister whether or not the Australian government was responsible for protecting residents through infection control guidelines, healthcare safety and quality standards. But he may, Mr President, I'm happy to withdraw it if he's going to get to that point.
Listening to the answer, I have to admit at this point I'm in no way willing to rule it's not directly relevant 18 seconds in. I do consider the material he was talking about to be relevant, but I'll continue to listen. Senator Colbeck.
One of the more preemptive points of order I've heard, Mr President. Mr President, so the Australian government is responsible for primarily responsible for funding and regulation of the aged care sector, and part of that regulatory process is a number of standards for which aged care providers are responsible to meeting, and that includes management of infection control and a range of other measures. There's 44 items in the standards that have to be complied with. And we regulate and assess all aged care providers across the country to ensure that they do meet those standards.
Order.
And of
Senator
course we have
Colbeck.
processes
Time
to
for the
deal with them if they
answer
don't.
has expired. Senator McMahon.
Thank you, Mr President. My question is to the Minister representing the Minister for Agriculture, Senator Ruston. The egregious decision in 2011 by former Labor Minister for Agriculture, Joe Ludwig, to shut down our live cattle export industry overnight caused extreme hurt across the industry. It decimated the viability of productive and profitable businesses and destroyed communities and families, particularly across my Northern Territory and Queensland. Can the Minister please provide an update to the Senate on the status of the Brett Cattle Company legal case?
The Minister representing the Minister for Agriculture, Drought and Emergency Management, Senator Ruston.
Thank you very much, Mr President, and can I thank Senator McMahon for her question and recognising the long-standing interest that you've had in this particular industry well before your time in this place. And as Senator McMahon rightly notes, the impact on live exporters of the decision by the former Labor government in 2010 to overnight ban live exports had a massive, massive impact on Australia. But it particularly had a massive impact on the families and the communities right across the nation who were directly involved in this industry. On the 22nd of July this year, the federal government has made the decision and announced the decision that it would not be appealing the federal court case, which ruled in favour of the Brett Cattle Company. Losses and damages will be appropriately determined by the court, because we believe that the prolonged pain, hardship that has been caused to this industry has gone on long enough. Because on this side of the chamber, we believe that the industry deserves certainty, we believe it deserves our support going forward, and that certainty has been denied this industry for some time now. The livelihoods of producers were just basically cut off overnight. And our focus from here on has to be on supporting our farmers, our exporters and the people that support that industry, who are an absolute integral part of the Australian economy, and never more importantly than they are now, along with our resources sector as one of the key pillars to get Australia and to support Australia through the absolute pain and devastation of this current COVID crisis. $1.7 billion industry that supports our economy, over 10,000 jobs with industry and associated industry. We as a government are absolutely strongly committed to supporting and growing the value of agriculture, and that includes our live export industry. We have a very strong record of doing it, and we will continue to do it. This was jeopardised. We're going to fix that problem now.
Senator McMahon, a supplementary question.
Thank you. Can the minister please outline the support the Liberals and Nationals government is providing to our cattle producers, particularly as they continue to manage through or recover from drought, floods and the impacts of COVID-19?
Senator Ruston.
Very much, and thank you, Senator McMahon. This government is absolutely 100% committed to supporting our farmers, and that includes our live cattle producers. This government has committed over $10 billion across the country to support drought response and recovery and preparedness actions following the 2019 floods, and we also committed $3.3 billion in additional support measures. The National Drought and Northern Queensland Flood Response and Recovery Agency made available $300 million in grants to support restocking and replanting, as well as rebuilding on-farm infrastructure that was damaged. This funding is helping all agriculture, but particularly our cattle producers, to get back on their feet, because we know when they're back on their feet, they do great things for the Australian economy. We understand there will be another drought, Senator McMahon, which is why we put in place the Permanent Drought Fund, so that we can provide $100 million a year during drought years to make sure that we're prepared and we're resilient to the impacts of droughts when they inevitably occur in the future.
Senator McMahon, a final supplementary question.
Thank you, Mr President. Can the minister please outline to the Senate the importance of the live animal export industry to Australia and our efforts to ensure extremely high standards of animal welfare?
Senator Ruston.
Much, Mr President. Well, live exports in this country are underpinned by very strong regulation that supports good animal welfare outcomes. We have a framework in place which focuses continually on making sure that we improve and to make sure that the industry meets the community's expectations. There are standards for things like vessel preparation, sourcing, loading, onboard management of livestock, making sure that things like ventilation, drainage, stock densities and the provision of food and water to our animals on these vessels is absolutely first class. We always make sure that there's an accredited stock person on board the ship, and in many instances there's a veterinarian as well. The framework also includes processes to investigate when a situation does occur and there is an incident. But we need to remember the overwhelming number of voyages that leave Australia with live animals on board are undertaken without any incident at all. The government absolutely condemns cruelty to animals, and that's why we put in place a world-class.
Senator Bilyk.
Thank you, Mr President. My question is to the Minister for Aged Care and Senior Australians, Senator Colbeck. Today, the Aged Care Royal Commissioners, the Honourable Tony Pagone QC and Ms Lynelle Briggs AO said, and I quote, "Had the Australian Government acted upon previous reviews of aged care, the persistent problems in aged care would have been known much earlier and the suffering of many people could have been avoided." How many of the 335 aged care recipients who have died from COVID-19 would be alive if the minister had acted upon previous reviews?
The Minister for Aged Care and Senior Australians, Senator Colbeck.
Thank you, Mr President. I wouldn't like to speculate on that as a figure. One of the reasons that we called the Royal Commission, Mr President, is that successive governments, and I think this has been also stated by commissioners, successive governments have not acted as they perhaps could have done with respect to aged care, and there is clearly work that needs to be done, Mr President.
Order.
And so I don't seek to draw a correlation between those many reports that have been done into the aged care sector before I came to the portfolio. I don't seek to draw that correlation. I again offer my condolences to every single one of those. I offer my condolences to every single one of the families who've lost a loved one through COVID-19 to the Royal Commission, to COVID-19, Mr President. But I don't seek to draw that correlation. The Royal Commission has. I acknowledge that, but I don't seek to do that. But what I do say, Mr President, is that from the outset of this pandemic, this government, through firstly its public health response through the National Health COVID-19 Response Plan and its engagement with the aged care sector, have worked continuously to provide advice to the sector on how they can mitigate the entry of COVID-19 into aged care facilities, and also, if it does get into an aged care facility, to protect the residents within the facility and also the resources to do that. And we will continue to do that. We've learned a lot about this virus over the last 12 months. We will continue to learn because there is still
Senator
more to learn.
Colbeck, time for the answer has expired. Senator Bilyk, a supplementary question.
Thank you, Mr President. Counsel assisting the Aged Care Royal Commission said that, and I quote, "Neither the Commonwealth Department of Health nor the aged care regulator developed a COVID-19 plan specifically for the aged care sector. How many of the 335 aged care recipients who have died from COVID-19 would be alive if the minister had planned to protect them?"
Senator Colbeck.
Thank you, Mr President. I reject the premise of the question, and I reject the premise of Senator Bilyk's question. We have worked closely with the aged care sector
Senator Watt.
as we've learnt more about this virus, and we've continued to provide advice to the sector and the resources that they've required without limit, as the pandemic has progressed. And we will continue to do that, Mr President. We will continue to do that. The Aged PPC continues to provide advice. The CDNA continues to provide advice. And we have acted on the advice of the health professionals all the way through this pandemic and the resources that go with it, Mr President, and the resources that go with it. Over $1 billion we've allocated to the aged care sector to support them and assist them to deal with the COVID-19 pandemic, which is racking the world.
Senator Bilyk, a final supplementary question.
Thank you, Mr President. 335 aged care recipients have died from COVID-19. How many more aged care residents have to die before the Prime Minister accepts full responsibility for keeping them safe?
Senator Colbeck.
Thank you, Mr President. And every single one of those 35, every one of those 335 deaths is an absolute tragedy. Every single one of those deaths is a tragedy. Absolute tragedy, and again my condolences to all of their families. We are dealing here, Mr President, with a global pandemic where we have, in this country, through our whole-of-government response, through the COVID-19 health pandemic plan, done exceptionally well. But of course, nobody is immune from the virus. None of us are immune from the virus. And until we get, if we get a vaccine, then we will continue to be susceptible. And we will continue to do, as we have done all through the pandemic, everything that we possibly can to support this sector.
Order. Senator Colbeck, time for the answer has expired. Senator, order on my left. Order on my left. Senator Henderson.
Thank you very much, Mr President. My question is to the Minister for Families and Social Services, Senator Ruston. Can the minister update the Senate on how the Morrison government is informing families at risk of violence about the support services that are available, especially during these difficult times resulting from COVID-19?
Minister for Families and Social Services, Senator Ruston.
Thank you very much, Mr President, and can I thank Senator Henderson for her question and her ongoing interest in making sure that we have the settings right to try and prevent domestic violence from happening before it even starts. But the national campaign, Help Is Here, is a campaign that we launched in May this year. It's funded through the $150 million domestic violence package that was announced. This extra funding is absolutely directed in making sure that anybody who might be at risk of domestic violence knows what support is available to them and where they're able to get those services. The Help Is Here campaign reaches Australians through a number of different ways. It's through the internet, in their homes, obviously on the television, but most importantly in places like shopping centres, magazines and newspapers, where people who may actually be at greater risk are often by themselves. The main two forms are through the 1800 RESPECT hotline and the dedicated men's line. The campaign uniquely reflects the challenges of the coronavirus pandemic by recognising that during the pandemic some people at risk of domestic violence may not be able to leave their house apart from perhaps to go shopping. The Help Is Here campaign aims to reach victims of domestic violence and abuse through the restrooms in shopping centres to make sure that they know where they can ring if they need to get some help if they are finding themselves in difficult times. By directing people to the national hotlines and through the partnership networks that we have, we provide assistance 24 hours a day, 7 days a week, so people can know that they can go online or onto the phone and speak to a trained counsellor from these particular initiatives that are being funded. I also want to thank the private sector for coming on board with this particular initiative with the campaign for Help Is Here, Channel 7, the major supermarket chains as well as Amazon. And can I also acknowledge the work of the states and territories to which we've provided $130 million to support them in their frontline service provisions.
Senator Henderson, a supplementary question.
Minister, what evidence is available to demonstrate the campaign is reaching Australians at risk of violence and providing them with the necessary support and information services?
Senator Ruston.
Thank you, Mr President. Well, I'm really pleased to say that the evaluation research results have shown that more than half Australians, when surveyed, had recognised, remembered the campaign and acknowledged that they had seen it. This is really important because increased awareness means that people will know automatically where they can get the support should they find themselves in need of it. As an example, in the middle of this year, the 1800 Respect hotline had received 86,000 contacts in the 3-month period leading up to the 30th of July 2020. In the same time last year, they'd received around 55,000 calls in the same period, a significant increase. The Men's Line also indicated that they had received an increase in calls. We know that more Australians know there is support out there, and that is a good thing, because we want them to know that they are not alone and the support services are there for them if they find themselves in a situation of needing them. And I would encourage anybody who finds themselves in a difficult situation to reach out to one of these two hotlines for
Senator
support.
Ruston. Senator Henderson, a final supplementary question.
Thank you, Mr President. Minister, it is good to hear Australians are reaching out for help. Can you please explain how the government is ensuring that vulnerable communities are getting the support they need as part of this campaign?
Senator Ruston.
Thank you very much, Mr President. Well, this campaign has targeted everybody who is in Australia. We want to try and reach them by as many different means as possible, whether it be through the internet, through normal channels like television and radio, in shopping centres, magazines, newspapers, because we want them to know that the two national hotlines are available to them. But most importantly, to make sure that people who don't speak English as their first language, and also making sure that we reach out to our Indigenous Australians to make sure that our advice is provided in an appropriate way. So for our vulnerable communities, the campaign materials have been tailored. For instance, in cold communities, we've translated our advertising materials into 14 different languages so that the audiences will be able to get access to the Help Is Here information. We've also worked with Indigenous mentors and Indigenous domestic violence survivors to prepare for distribution appropriate material for news outlets and specifically with the channels of distribution that they're most likely to use.
Senator Cormann.
Thank you very much, Mr President. I ask that further questions be placed on a notice by